Patients with hidradenitis suppurativa can develop Candida overgrowth. And let's talk about it. If you may have Candida overgrowth on top of your HS, if you're dealing with a white fuzzy tongue, if you're getting recurring yeast infections, if you're craving sugar all the time, although that can also be related to like insulin resistance. But Candida is going to drive inflammation and can worsen your symptoms. But why do we see like this overlap of like Candida overgrowth among HS patients? So we're gonna dive into it because there's a few different reasons why this can happen in our community. But caveat in general, as a nutritionist, I've seen Candida overgrowth literally in a lot of people just because of overuse of antibiotics, overconsumption of sugar, et cetera, et cetera. So it's not just HS people, but we're talking about HS people because that's what we do here. Hi, I'm Christina. I'm a holistic nutritionist and HS warrior, and I create content to help people with hidradenitis suppurativa understand what's happening with their bodies and also make the diet, lifestyle, symptom management connection. So if you have any questions, feel free to leave a comment with a question and hit that follow button to keep learning. I'm going to be reading from my notes to make sure I don't mess this up and miss anything. So let's dive into it. Patients with hidradenitis suppurativa are prone to developing Candida overgrowth, which can exacerbate the condition and negatively affect wound healing and flare-ups. This relationship stems from several overlapping factors related to immune dysfunction, skin barrier integrity, and systemic inflammation. Immune dysregulation. HS is an inflammatory condition marked by dysregulation of the innate and adaptive immune systems. Immune suppression or imbalance, particularly involving Th17 cells and interleukin-17, the IL-17 pathways, can impair the body's ability to keep Candida under control. IL-17 is critical for fungal immunity, and its dysregulation creates a favorable environment for fungal growth. Chronic antibiotic use. HS patients are often prescribed long-term antibiotics to control bacterial infections and lesions. Prolonged antibiotics use disrupts the gut and skin microbiomes, killing beneficial bacteria that normally suppress Candida overgrowth and leading to opportunistic overgrowth in the gut, skin, and mucous membranes. Now, I understand there's reasons why doctors prescribe antibiotics for HS because they see a lot of their patients respond positively to them after 1 or 2 rounds. But I do think that if you've done 1 or 2 rounds and it's not getting better and it keeps coming back, continuing to use them is going to just turn into the like cons are outweighing the pros now, and maybe it's time to have a conversation with your doctor about alternative routes, right? Because it's very well documented that the overuse of antibiotics will negatively affect your gut health. And actually, Dr. Jamie Weissman did do a video about like the emerging. People are starting to realize like maybe overdoing antibiotics for the HS patients is actually making it worse in the long run. And while I know that the studies aren't super conclusive yet, if we use a little common sense, it's a little bit like, maybe we should look at other options, but that's a video for another day. So compromised skin barrier. Reoccurrent abscesses, sinus tracts, and open wounds in HS disrupt the skin barrier, providing an entry point for Candida to colonize and grow. Moist, warm areas, commonly affected by HS, underarms, groin, and under breast, are ideal environments for Candida proliferation. Metabolic and hormone factors. Many HS patients have associated conditions like insulin resistance and PCOS, which create higher glucose levels in tissues. Candida thrives in glucose-rich environments, increasing the risk of overgrowth. Now, if you've been in the community for an amount of time or even on my page, you'll see how many people say over and over again, sugar's a trigger, sugar's a trigger, sugar's a trigger. And I would always argue that sugar isn't necessarily inherently that you're reacting to the sugar as like an allergy, but your body's reacting to sugar because you either have insulin resistance or Candida overgrowth, which is why people with HS who are like, oh, I can't have sugar, or yeasty foods, if you react to vinegars, to brewer's yeast, to super starchy foods, it's likely that it's because when you eat that, it feeds the Candida, right? Dietary contributions. Diets high in refined sugars and carbohydrates can also fuel Candida growth, a common issue with individuals struggling with inflammation and metabolic imbalances. And we know because studies show that about 45 to 50% of HS patients are also dealing with insulin resistance, which again is why if you've been on my page at any amount of time, you'll see that one of the first things that I tell people when they ask me, what should I do? I'm like, reduce your sugar intake, up your protein. Reduce your sugar intake, up your protein. Okay. And then impaired lymphatic function, which you should have seen my last video about lymphatic function. I go into detail. Lymphatic dysfunction, common in HS due to chronic inflammation, reduces the body's ability to clear pathogens, including Candida, allowing for the systemic fungal overgrowth. So Candida overgrowth is going to really have a big negative impact on hidradenitis suppurativa, and it has a really big issue on wound healing and HS, but that is a video for another day because this one's already a little long. So I hope you learned something. Let me know if you have any questions. I'll see you guys soon.